Hello everyone, I am health coach at Besugarfit. My name is Riya Datta and today we will be discussing about diabetes symptoms in men. So due to the nature of our work, we spend most of the day engaged in activities that keep us sitting or lying in one position. But our bodies are not designed to remain stationary for a prolonged time. This has resulted in a growing incidence of lifestyle diseases. And when you talk about lifestyle diseases, the most common name that comes to your mind is diabetes. Some diabetes symptoms in men may vary significantly from that of women. According to the findings of the International Diabetes Federation, India presently comprises 77 million individuals with diabetes. The prevalence of diabetes in men has been found to be 11.8% compared to women, which is 9.5%. Mostly men above the age of 45 with a BMI greater than 32 are prone to type 2 diabetes. Type 1 diabetes is usually diagnosed in men before 30 years of age. Type 1 and type 2 diabetes symptoms for men and women are fairly similar. However, there exist certain signs of diabetes that are more specific to the male population. Diabetes symptoms for men and women are largely similar. The most prevalent signs of diabetes are increased thirst, frequent urination, sudden weight loss, tingling sensation in the extremities, dry and itchy skin, slow healing wounds, hazy vision, patches of dark skin, constant fatigue. Following are some type 1 and type 2 diabetes symptoms in men. Number 1. Increase in appetite. Insulin resistance causes reduced glucose breakdown. There is a lesser release of energy. As such, the person consumes more food to make up for it. Number 2. Feeling of drowsiness. A general feeling of lethargy sets in due to constant fluctuations in blood glucose levels. Third, breathing issues. One of the familiar symptoms and signs of type 1 diabetes in men is laborious breathing. This is caused by a short-term complication known as diabetic ketoacidosis. The kidneys become overburdened to remove the toxic ketones being formed because of this condition. Consequently, the lungs end up expelling this excess ketones. This causes shortness of breath. Number 4. Frequent states of near unconsciousness. High blood sugar levels results in dehydration, and low blood sugar levels deprive the brain of glucose. Both these conditions lead to states of stupor. 5. Urinating frequently. When your blood sugar levels are high, your body gets rid of the extra sugar via the kidneys. This leads to urinating more frequently or often. 6th, increased thirst. As a result of increased urination, the body gets dehydrated and therefore you feel a frequent urge to drink water. 7. Low levels of testosterone. Insulin sensitivity decreases testosterone levels, resulting in low sex drive. It is characterized by a reduced energy level and a feeling of fatigue. 8. Erectile dysfunction. Since diabetes affects the autonomic nervous system, it may lead to problems concerning sexual health. Erectile dysfunction, or the inability to sustain an erection, is one of the common signs of type 2 diabetes in men. 9. Retrograde ejaculation. Backflow of semen takes place into the bladder instead of passing out through the urethra. This may impair fertility. It happens due to defective blood sugar control leading to bladder neuropathy. 10. Incontinence and difficulty in bladder control. Urinary tract infections and incontinence are common signs of type 2 diabetes in men. 11th. Genital yeast infections. Yeast feeds on sugar. Since excess sugar passes out through urine for individuals with diabetes, yeast infections may occur in the genital areas. Symptoms include redness, swelling, discomfort, and foul odor. 12th, loss of muscle mass. High blood sugar levels cause autodigestion of fat, muscle, and protein to derive energy. This reduces muscle mass, and this is the reason for unexplained weight loss. 3rd, enlarged prostate. Urinary incontinence is a common symptom associated with the development of an enlarged prostate. Complications of diabetes usually develop gradually. If your blood sugar levels are uncontrolled for longer durations, then your risk of developing complications is high. Certain complications of diabetes in men include cardiovascular diseases. Having diabetes increases the risk of having heart problems such as chest pain, heart attack, strokes, atherosclerosis, etc. Nerve damage. Excessive sugar in the blood damages capillaries, which leads to numbing, tingling sensations in feet and hands. Damaged nerves can also lead to erectile dysfunction in men. Kidney damage. Diabetes damages the blood vessels in the kidney that disrupt the filtration process of waste from blood, leading to kidney damage. Food damage. Elevated blood glucose level leads to damaged blood vessels in the foot, which causes a delay in the healing of wounds and other infection. 5th, eye damage, known as retinopathy. The damaged blood vessels of the eye lead to eye problems and blindness in some cases. Skin disorders. Having abnormal blood sugar levels causes skin problems such as dark patches on the skin, bacterial infections, fungal infections, etc. Depression. Having diabetes can be overwhelming. People with diabetes usually suffer from mental problems such as depression, anxiety, etc. So, the following factors increases the chances to develop diabetes in men. Number 1, obesity. 2, being more than 45 years of age and leading a sedentary lifestyle. 3rd, high blood pressure and cholesterol levels. 4th, family history of diabetes. 5th, history of cardiovascular complications. 6th, high consumption of alcohol and nicotine. 7th, fat storage in the abdominal area. Regular exercises and following a proper diet can go a long way in preventing complications in diabetes. Diabetes in men raises many questions. Can diabetes affect men's fertility? Or is diabetes responsible for losing muscle weight? The answers to these lie in the symptoms and how well they are managed. A suitable diet, regular exercises, and cutting down on the risk factors to help to control the condition. So definitely talk to your healthcare provider if you experience any of the symptoms. Early diagnosis is a lifesaver in most cases. Thank you.